This was actually the second in a series, maybe third if we count the fact that it was inspired by Becky's master's work in Thunder Bay of community-based participatory research with injured workers. And so we had done a study a survey in 2009 as well. But we wanted to do something a little more rigorous and build on our experience. Unfortunately, this became known as the poverty survey. So kind of biased right from the get-go. So in reflection, since this is the time to reflect on this, that would be one thing I would avoid. Having it become known as the poverty survey. So as Steve said, we involve people in every aspect of the survey design, and to the point where I think they're sick to death of it. And this is just a listing of the people who are involved. So today I'm just going to talk about what is community-based research, why we do it, and the results of what we found in 2010. Some of the results. I should say that if you see the report that was handed out, it's preliminary findings, and that's as far as we got. I'm afraid that's the working for free part. So what is community-based research? Well, this is all adapted from the Center for Community-Based Research in Kitchener, I believe. It's practical. It looks at the questions that the community wants researched and not what academics want researched, because sometimes those things are quite different. It's accessible. It's carried out in community settings. It's meant to be part of the community, as Steve was saying. It's collaborative, and as I said, we had people involved in every stage, and it's action-oriented. So it starts with the assumption that there are inequalities and there's social injustice, and we need to do research that takes that into account, which brings us to the major disadvantage of community-based research is considered biased. And I don't know how many of you were here last night, but we had a really interesting discussion about bias. The problem with a sample that you gather the way we did, just people talking to people, is that these are self-selected people. They probably have an axe to grind. They probably have a complaint already. So for that reason, we couldn't possibly call this a representative sample, but we could talk to people about their experiences. The other thing that we talked about last night as well is that a perceived problem in scientific research, that the subject and the researcher should really have a relationship, because the researcher needs to be objective. So we can't make that claim either. We definitely weren't objective if we were calling it the poverty survey. And as a result, we couldn't generalize anything about our sample, which was fairly substantial. It was over about 290 people. So why would you bother then? Why would you bother doing research if you can't say, this is what this community looks like? You can say with certainty, or some certainty, that this is what's going on. Well, we were very clear from the beginning that this was an organizing tool, as Steve said. And an educational tool. This wasn't part of RACWE, but it was kind of beside RACWE. And I still don't know exactly, this just kind of bubbled up from Montywood. They wanted this survey done. And I don't remember now how we ended up doing this very community-based survey, while Perry was pretty much more rigorous than in RACWE. But I blamed Steve. I'm sure he was behind. But it turned out to be a very useful exercise to be doing them in parallel, because in terms of educating people and injured workers about research, there were some things that came out that I'm going to talk about in a minute that were actually became a teachable moment, which is an expression I hate, but it did. It gave us a chance. It will give us a chance to talk about why sampling is important. The other thing this did was it tested perceptions. A lot of concern was being raised within injured workers consultants people who are advocating community workers, and that people are losing their homes. Like, this didn't used to happen. Well, is this widespread, or God can't drive a car anymore? He can't afford to drive a car anymore. Is this happening? So from that point of view, this sample gave the advocates and the community a chance to test their perceptions, but also to provide some descriptive data. So while we can't say that it's representative of the injured worker community broadly, they did get a chance to get some descriptive data about the people they serve, and that's always helpful. The other reason to do community-based research is that there are hidden populations. There are hard-to-reach groups. And some of the characteristics of those groups are they're isolated in society, there's a lot of stigma attached to whatever they're doing, perhaps they're even doing things illegal. So, for example, it's hard to get a sampling frame, it's hard to know how many IV drug users who have HIV are out there. And they're probably not going to come and sign the list. So there are these important hidden populations, and for some of those populations, doing community-based research is the only way to find out what's going on. You might not be able to, again, you can't maybe generalize too far, but these are important issues and important problems that we need to look at. So injured workers are kind of in between. They're not a hidden population, and we do have WSIB data. We also have all kinds of problems with WSIB. As we all know, when we were talking last night, I suspect there was some very severe criticism of the WSIB data, and that we probably shouldn't use it. But then, what else do we use? It's not like we're recording injuries and have a really good surveillance system on occupational health and safety. Well, it's the same sort of thing for certain populations. This might be the only way to get information about it. So that's not quite the case with injured workers, but there are definitely some barriers. Injured workers might be afraid to talk to the WSIB. Anything connected with the WSIB. There's language problem, language barriers, and there's a stigma. And probably the most important aspect that both Emil and Harry talked about is that there are suppressed claims, or there are claims that are denied. So, in our group, it's okay. In our group, in our sample, 17% of respondents asked. We asked them, did they have a work injury? Excuse me, in their opinion, that had not been compensated. So that's that's a pretty big chunk of people. Again, no idea if that's a number that we could use across the sample, but it was represented a fair number of people. You'll see in the results that the questions kind of got framed in terms of what we were interested in. Have you lost your car? Things like that. We made sure, one of the things about doing this kind of research is, as Wayne Luchuk was saying last night, that you need to be careful. Everybody's biased, so you really need to be careful. And so we did try to be careful. We tried to be very clear about where the people were coming from and what the limitations were. And the vast majority of people in the study did come from an injured workers group or a legal clinic or some kind of representative. Although there is the pink, I don't have the numbers, sorry, John. I think it was over 70% came from a situation where they were disputing a claim. So clearly, we were not getting a representative sample, but we were getting the people who were having problems. Though there were a chunk, too, that just found it on the internet. And of course, because we didn't do interviews, we couldn't really explore that very much. And we did have representation from all across Ontario, but again, I couldn't tell you that was represents the population of the province or anything. But it was just kind of neat that it spread that far. We had one from Ear Falls or Pickle Lake or somewhere. And in the end, we had a sample of 291, and we
got their characteristics, how many men, how many women, which is going to be important in a minute, age. It was kind of interesting that most of them were born in Canada. We might have expected more people, or not newcomers anymore, but immigrants. Although that might have been partly because the survey was in English and French, but also we overcame some of those language barriers because we disseminated the survey into clinics with people who have the languages of the people they're serving. Of course, that introduces a whole bunch of other possible errors, and one of the things we would need to be very careful about, were we to do this again, would be to, the training of volunteers is really, really important for them to be as consistent as possible in how they interpret the questions and help people with the questions. Most people did it online, but a lot, I forget the numbers now, but there was a substantial number who sat down with people, with one of their reps, and filled it all out. Another really interesting finding was that 80% of the people in the sample had some kind of post-secondary training, college, some university, some kind of trade or skill. About half were married when they were injured, and of course, because they're injured workers, they were all working, but nearly 90% of them had full-time jobs. So when they were injured. And I think that's important just because in some ways I feel like work injury is a poverty creation program rather than a poverty reduction program, to get people who are working and kind of making their lives work, and then bad things happen. So this is where I'm eternally grateful to Perry, because now this isn't from your publication, this is from before. And she mentioned earlier that she wasn't able to get a random sample, but when she compared her sample, which is the first column there, they have 494, to the study population more broadly, 2,004 people, and they were able to get these characteristics, which I'll say in a minute. Oh, this is just age, really. When they were able to compare these characteristics, their population did look very much like the study population. So all this is a breakdown in age and the percentage of people in those age groups, 25 to 29, 30 to 39, 40 to 49, and 50 plus. And the other consideration is that the cutoff in Perry's sample was 55, whereas we didn't make any upper cutoff for age. So what you can see in this slide is that while Perry's population and the way she sampled is very close to the study population, ours isn't. Ours is quite different, particularly for the 50 plus. And so when our numbers came up, 57% unemployment, and very high poverty rates and that sort of thing, well, certainly the unemployment rate, I think, is explained in part by this. But I also felt like this was a good way to show injured workers that it really does matter how you sample, that things do get skewed. Doesn't mean you can't talk to these people, but it means you need to be aware of that. And it also reflects, I think, something Marion once said to me, is that a lot of the workers they see are older workers with claims that have been going on forever. So this is kind of validates that as well. But I did think this was an important kind of educational moment to explain why we get so hung up on sampling. So among those that we did talk to, though, we didn't do any of the fancy stuff. I'm a struggles with numbers person rather than a numbers person, but also it just wasn't the nature of the study to do that. So we just did some very simple analysis of who was working full time before their injury and who was unemployed before and after. Well, 89% of the people were working full time before their injury. 9% were working full time after. Obviously, 0% were unemployed because they got injured at work, and so there's our unemployment rate of 57%, just for this group, not for injured workers in general. But the best part of our study, I think, the most important part of our study, and we didn't even interview people. I almost recoil at the idea of interviewing people because they had places to make comments, and as I was coding these, I had to stop sometimes. The stories were so sad, and people were so frustrated and so hopeless that I'd have to just leave it for a while. I couldn't keep going. And here are some of the things they wrote. All I want is a job where I can earn as much as I did before. The point being, I want to work, not collect benefits till 65. Another one said, I would say the hardest part is that the employer not wanting you back after an injury. And of course, there's some evidence too that that's usually the best outcome for the workers when they can get hired by their injury employer. We also looked at personal income, not in nearly the same depth as you've seen. We were roughly using the LICO of $25,000 per person. Just person. We didn't get into family income, but as you can see, we didn't have very many. 14% were low earners before their injury. 66% were low earners afterwards. Again, that's why it feels like a poverty creation plan to me. When in fact we all know that the principles of compensation are to compensate you for what you lost by having an injury. Again, the comments are the most telling part. I basically had my earnings cut in half, although I'm still carrying a debt load based on my earnings of my last employment. Another one said I've lost in excess of 30% in the last 10 years. And then we had people, the really worrisome ones, I've run out of LTD and welfare won't touch me because I have a pending tribunal case. And I read that and think, how are they managing? We found that 1 in 5 who owned a car before their injury weren't able to own a car after. And this was not about age and losing your license. We asked them, why do you not have a car? And they said, we can't afford it. This was something else that was cropping up among the representatives. Injured workers are using food banks. I mean, we haven't been seeing that either. So we asked a question about food banks. Have you ever had to use a food bank? We gave different, specified periods of time and that sort of thing. And we found that nearly 30% of this group had used a food bank after their injury, which is pretty shocking. So is this one, the housing situation. So about half of the people had to change their housing situation after their injury. Half of our 264 people. Nearly 20% had to sell their homes. And this isn't all individuals, so it doesn't add up to 100 or anything. But people moved into less expensive homes, or they moved into subsidized housing. We had 17% of our group who moved into subsidized housing, and nearly a quarter had to move in with friends or family at some point after their injuries. And we can just imagine how devastating that would be. Losing my house because no one wants to hire a 59-year-old man with a medical history. My address will soon change soon, and it might be to a shelter. Someone else said, we've been evicted once and came very close a second time. Although we managed to avoid it for now, it is a constant fear and possibility in the future. The whole issue of household income and where it comes from, it has been very important to the injured worker community as well, and with good reason, although I don't know that they would necessarily see this as the good reason. There's a whole body of social policy literature that suggests that different welfare states do things differently. And the ones that create the most equality are those that focus on individuals. So that, and the analysis was done for women. So if your welfare state gives you things like a child tax benefit, you're probably going to be, that doesn't encourage you to leave the family if you want to leave the family. If you had a universal child care system, you have more freedom. So it's these kinds of decisions that the welfare states make in their programs. And workers' compensation, at its inception, was meant to make sure that the injured worker did not have to rely on family or community. Again, it's the idea of compensating for what would have been received had the injury not happened. So we were very concerned about the sources of household income, And as you can see here, about 30% reported that their husband their spouse, there was another main earner in the house, which, I mean, this is a very simple analysis, but it certainly jives with what we've been hearing. About 25% said that workers' compensation benefits were the highest source of income. Sorry, I didn't explain that. We were asking, what's the highest source of income in your household? I was actually pleased that it was that high, 25%, to be honest, because it should be. So we talked a little bit about this last night as well, trying to figure out which benefit programs are doing the heavy lifting, and are they doing the lifting that they should be doing? And that's a very complex question, obviously. But this was kind of aimed at starting to look at that from the community's point of view, because workers' compensation is paid for by employers, and all the rest are paid by taxpayers. And pretty much all the rest are paid by taxpayers or contributions. And that's a pretty important distinction. So more quotes, because really and truly that's what this was all about, was talking to people way more than the numbers. Without the assistance of my family and friends over the past 8 years, I'm not sure where I would be now. So that kind of flies in the face of a system that allows people to maintain their individual dignity. And I think my background is critical disability studies, and I think that's an important concept as well for all people with disabilities. You know, I've looked at reports on Europe where, well, you know, once you take family income into account, you know, people with disabilities aren't that much poorer. But that's kind of not the point. The point is that we should all be able to live in dignity, regardless of whether we have a disability or not. This quote is one that Steve used in a radio interview. I feel as if I am being punished over and over again for being hurt on the job. I feel embarrassed, ashamed for not being able to be there and being able to be a proper husband and a father to my wife and children. I feel like a drowning man who is taking his wife and son down with him. Another one was, due to my illiteracy, WSIB refused training. Not that I cannot physically do my job. Now that I cannot physically do my job, WSIB uses my illiteracy as a reason not to retrain, yet they will pay $11,000 for a resume that I can't read. Another one was, we were left bewildered and frustrated and psychologically damaged, forever affecting ourselves, families, and friends. So what can we conclude from all this? Well, this certainly confirms some of the perceptions of the injured worker community in terms of those people who are seeking help, who are in disputes over claims. And even though this is not a representative sample, it is 300 people, many of whom are having very serious problems. And so I think that, more than anything, speaks to what we were talking about last night. Does it matter how many people are suffering, or does it matter that people are suffering? And that is the great freedom that this kind of research gives you. You can sort of ask that question. We ask the question, why should anyone be poor? Why are you laughing? That wasn't a joke, John. But we have the freedom to say, well, you know, we don't care if it's 10%, 20%, 30%. We've just talked to these people whose lives are destroyed, and we want to know why in a rich society like ours, anyone should have to be poor. There is a joke on here, John, unless it's somebody holding up a sign, I think in Times Square, during a demonstration saying, sorry for the convenience, we are trying to change the world. Sorry for the inconvenience, we're trying to change the world.
Do you have a source for that one? It's good.
It's from the World Occupying Movement.
Okay.
Yeah, in 2011. So that's kind of where we were coming from on this, that we wanted to ask these bigger questions, more difficult questions for sure, but at least start that conversation. You know, we're talking about people's lives here, and it doesn't matter how many, or does it matter that, you know, people are suffering, and especially in a rich society like ours. And I do think that, based on, again, on our conversations last night, where we were saying, so what do we do? What do we do? I think something that's really important and something that maybe is changing is to try to address this neoliberal narrative that taxes are too high, taxes need to be low, and we're all, we're all responsible for ourselves and family. I love the one, we're giving money to families because we know they can make better use of it than the government can. Well, shall we all pave the road in front of our house? Yeah. Shall we all educate our own children? It's ridiculous, but it sticks, unfortunately. Yeah. And I do think that the issue of workers' compensation benefits and disability benefits more generally does question that. And the fact that, I don't know if Emil's data showed this, but Perry's data showed that there is structural poverty. And the only way that I'm aware of in capitalism to not have structural poverty is to redistribute wealth, and yet we recoil from that because of a neoliberal narrative that is largely untrue. So that's my political statement, but that's it. I'm just glad that we have the leeway in community-based research to kind of push some of these points. So that's it.